Hi, my name is Amy Oxentenko, and I'm a consultant in the Division of Gastroenterology and Hepatology. I'm the senior author on a paper that will be published in the March 2011 Mayo Clinic Proceedings entitled The Effects of 16-Hour Duty Periods on Resident Education and Patient Care. A bit of background into our study. In 2008, the Institute of Medicine came out with their report suggesting that duty hours should be changed. And one of their recommendations was that duty hours should be limited to a shift no longer than 16 hours. In June of 2010, the ACGME substantiated certain aspects of that report, stating that first-year residents should work duty hours no longer than 16 hours. In response to the Institute of Medicine report in 2008, we decided to have a pilot or intervention seeing what the results would be of having duty periods no longer than 16 hours on resident service in terms of patient care metrics and resident outcomes. So what we did is we had one intervention month and two control months where we had internal medicine residents work duty periods no longer than 16 hours, and in fact they were only scheduled a maximum of 14 hours on any of their shifts. What we found during our intervention was that when we looked at all of the patient care metrics, which included things like 30-day mortality, 30-day readmission rate, ICU transfers, that there was no difference in terms of these patient care metrics during the intervention month compared to the control months. What we did find, however, was that residents felt that their comfort level with transfers of care and cross-cover was decreased. They also felt that the quality of their education was decreased, largely because of their inability in the intervention month to attend conferences. And finally, another thing that we found is even though on the intervention month the number of hours that residents worked were overall fewer, there was a significantly increased number of work hour violations because of the increasing number of times they had less than 10 hours off between duty periods. So basically substituting one potential work hour violation for another. In terms of how this study affects clinical practice, one important aspect is that we were able to create this intervention with shifts no longer than 16 hours on resident services without having to increase the number of residents on those rotations and without having to use allied staff or any other support for this work hour difference. Additionally, we did not have to decrease the number of admissions to this resident service because of the intervention. In terms of what this study means for patients, reassuringly, with these duty hour changes that are taking effect in July 2011, that I think patients should feel comfortable that based at least on our study, there is no difference in terms of important patient outcomes based on these reduced shifts for internal medicine residents, especially those who will be rotating in their first year of residency. In terms of the next step for this research, given the ACGME has required that all programs, residency programs, institute the 16-hour duty period maximum for first-year residents in July 2011, programs clearly need to look at some of the variables that we had in our study, including patient metrics, educational outcomes, and duty hour violations as these policies are put into effect, just to make sure that we don't see adverse outcomes in terms of patient care metrics, even though we didn't find them, and also to make sure that we're not having increased work hour violations in other areas like we found. In terms of the takeaway message, residency programs still have several months before the ACGME requirements take place in July 2011. Over the next few months, residency programs really need to review and scrutinize their cross-cover and transition of care, their educational programs, and have a way to clearly monitor their duty hours, given these were areas of concern that we found by limiting duty hour periods to no more than 16 hours.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.